Imagine, if you will, a highly sophisticated water treatment plant. Okay, but this isn't just any plant. It's this multitasking marvel that not only filters out all the waste, but also meticulously regulates water pressure, constantly manages acidity, and even produces chemical messengers, hormones, telling other parts of the system what to do. Now, here's the truly wild part. This incredible silent powerhouse is running 24/7 right inside your body. That, my friends, is your kidneys. Today, we're taking a deep dive into these, well, unsung heroes of your body. They're truly astonishing organs, often overlooked until something goes wrong. And they have far more surprising roles than you might think.
Absolutely. And our mission for you today is really to give you a shortcut, a clearer path to understanding this essential system. We're going to unpack how these vital organs function, how doctors actually assess their health, and then explore some common yet, distinct ways kidney failure can happen, pathways that might genuinely surprise you. You should walk away with not just facts, but a much more insightful picture of what's going on behind the scenes.
Okay, let's unpack this then. When we talk about kidneys, we're usually picturing those two bean-shaped organs, right? Each about the size of a fist, nestled just below your rib cage. They are definitely the core of your urinary system, but what's their main goal? Their primary overarching directive. Why are they so absolutely central to overall health?
You've hit on the core concept there. Their real magic, I think, lies in maintaining what we call homeostasis, keeping your entire internal environment incredibly stable. Think of them as the ultimate internal peacekeepers, constantly adjusting everything. Fluid levels, electrolyte balance, making sure all your other systems can operate optimally.
And at the heart of each kidney's incredible work is this microscopic structure called the nephron. It's basically the kidney's functional unit. What truly blows my mind is that each kidney contains about 1 million of these tiny, intricate filtration factories. How do these tiny things manage such a huge task?
It is absolutely mind-boggling, isn't it? And within each of those million nephrons, urine creation is this precise three-step dance. The first step, that's glomerular filtration. Here, blood pressure forces water, waste products, small solutes from this tangled ball of capillaries, the glomerulus, into what's called Bowman's capsule. Now, what's crucial to remember here is that large, important molecules like proteins and blood cells are specifically left behind. They don't pass through this initial filter.
Okay, so it's selective right from the start.
Exactly.
Yeah.
Then the filtered fluid, now called filtrate, moves into the renal tubule, and we get to step 2, tubular reabsorption. This is where the kidney becomes incredibly selective. It decides what's too valuable to lose. It draws essential substances like most of the water, glucose, amino acids, vital ions, pulls them back into the blood.
Retrieval, like grabbing the good stuff before it goes out with the trash.
Precisely. It's a highly efficient retrieval system, making sure your body keeps what it needs. Finally, we have tubular secretion. Now, this isn't passive, it's an active process. The kidney proactively transports specific waste products and excess ions, things like hydrogen and potassium, from the blood into the tubule to be excreted.
Wow.
So it's not just filtering, it's actively refining, removing any last bits of unwanted material directly into the urine pathway.
So it's not just a simple sieve at all. It's this whole chemical lab and pressure regulator.
Yeah.
But what I find truly incredible, though, is how much more they do beyond just that filtration. Are they almost like multi-talented command centers within the body?
Absolutely. They are far more than just filters. Far more. For instance, they're key players in regulation of blood pressure. When your blood pressure drops, the kidneys sense that, and they produce an enzyme called renin.
Okay.
This kicks off a whole cascade known as the renin-angiotensin-aldosterone system, RAAS, which ultimately works to bring that pressure back up.
Right, I've heard of RAAS.
And they also tirelessly manage your blood pH, maintaining your body's critical acid-base balance. They do this by reabsorbing bicarbonate and secreting hydrogen ions. And if that wasn't enough, they're powerful hormone producers. They create erythropoietin, or EPO.
EPO, yeah, for red blood cells.
Exactly, stimulates your bone marrow to produce vital red blood cells for carrying oxygen. And they produce calcitriol, which is the active form of vitamin D, absolutely essential for calcium absorption and, strong bones.
So if we connect this to the bigger picture, then, it becomes really clear why kidney health isn't just about filtering waste. These small organs are truly the silent architects of your body's most fundamental balances.
Exactly. This broad range of functions means kidney health impacts so many other body systems. Think about it. They're not just removing toxins. They're directly influencing your blood pressure, your oxygen carrying capacity, even the strength of your bones, often long before you'd feel any direct kidney pain. This interconnectedness is truly profound, and it shows why we really can't isolate kidney health from our overall well-being.
It's truly amazing how intricate these systems are. But with such complexity, it really begs the question, how do doctors even begin to assess if they're working properly? How do we look inside this black box, so to speak? Well, the gold standard, the best overall measure of kidney function, is something called the glomerular filtration rate, or GFR. It essentially tells us the volume of blood filtered by those glomeruli per minute. Now, doctors don't usually measure it directly, they estimate it, which is why you'll often see eGFR. And a key number to remember is that an eGFR below 60 lmn 1.73 meter-decile for more than 3 months is actually the diagnostic threshold for chronic kidney disease, or CKD.
Right, that GFR is key. And beyond GFR, doctors look at two crucial waste products in your blood. The first is serum creatinine, SCR. This is just a normal waste product from muscle metabolism. Healthy kidneys filter it out efficiently, so if your serum creatinine levels are higher, it generally suggests your kidneys aren't filtering effectively. However, it's not a perfect measure because creatinine levels can be influenced by things like your muscle mass, your age, and your sex. A very muscular person might have slightly higher creatinine naturally, for example.
Okay, so that makes sense. What's the other one?
The second is blood urea nitrogen, or BUN. Urea is another waste product, this one from protein breakdown in the liver. A high BUN level can also indicate poor kidney function, but it's less specific than creatinine. Your BUN can be elevated by other factors too, like a high protein diet, severe dehydration, or even, say, gastrointestinal bleeding.
So it sounds like these individual numbers, they aren't perfect on their own. Does that ever make diagnosis tricky? Or is it about piecing together a bigger puzzle? What about their ratio? I understand doctors often look at the BUN to creatinine ratio. What makes that combined number such a powerful diagnostic tool?
That's a great question because looking at the ratio is where we get really specific. It helps answer the question, how does that ratio help us pinpoint the cause of the kidney issue? Well, if you have a high ratio, typically greater than 20.1, it often suggests what we call a pre-renal cause.
Pre-renal, meaning before the kidney.
Exactly. The problem isn't with the kidney itself, but rather with decreased blood flow to the kidneys. Think severe dehydration, congestive heart failure, or even GI bleeding where the digested blood acts like a protein load. The kidney is basically healthy but starved of blood flow, so it reabsorbs more urea trying to conserve water, while creatinine excretion stays relatively stable. That bumps the ratio up.
Okay, that makes sense.
On the other hand, if you have a normal ratio, usually between 10.1 and 20.1, but both BUN and creatinine numbers are high, or even a low ratio, less than 10.1, this more often points to intrinsic kidney damage.
Intrinsic meaning damage inside the kidney.
Correct. Actual damage to the kidney tissue itself. In this case, both waste products might build up proportionally, or maybe the damaged tubules just can't reabsorb urea as effectively. The ratio really tells us where to look first.
Beyond blood work, I imagine doctors get a ton of information from your urine. A urinalysis, or UA, that's a fundamental two-part test, correct? Dipstick and microscopy.
Indeed. And the findings from a urinalysis can be incredibly telling. For instance, the presence of protein, specifically albumin, in the urine is a crucial sign of kidney damage. Healthy kidneys just shouldn't let much albumin pass through. In fact, a urine albumin to creatinine ratio, or UACR, greater than 30 milligrams is often the most sensitive early test for kidney damage. It can be the first alarm bell.
Wow, that's sensitive.
Very. We also look for blood or hematuria, which can indicate things like kidney stones, infection, or more serious glomerular diseases problems with the kidney's actual filtering units. But perhaps most diagnostically, we look for casts. These are these tiny cylindrical molds of the renal tubules, formed from cells or proteins that get packed in there.
Cast.
And they are highly diagnostic. For example, red blood cell casts strongly suggest glomerulonephritis inflammation of those critical filtering units. White blood cell casts point to kidney inflammation, maybe from an infection like pyelonephritis, and perhaps most tellingly, muddy brown granular casts. These are a classic, very specific sign of acute tubular necrosis, or ATN. That's a common type of intrinsic kidney injury where the tubule cells themselves are damaged.
Muddy brown casts. That's quite a specific clue. And sometimes you need to actually see what's going on, right? Imaging tests like a renal ultrasound must be incredibly useful.
Absolutely. Ultrasound is great. It's non-invasive, readily available. We use it to check kidney size, shape, and look for obstructions like hydronephrosis, that's swelling from urine backup, maybe from a stone or something blocking the ureter. Also, small shrunken kidneys on ultrasound can be a strong sign of chronic, long-standing disease. For even more detail, doctors might use a CT scan or MRI.
More detail, right?
But while imaging gives us a kind of structural map for complex cases, a kidney biopsy is truly the gold standard for diagnosing specific kidney diseases. By taking a tiny sample of kidney tissue, we can examine it under a microscope. That reveals the exact type and extent of damage. It gives us definitive answers when other tests are inconclusive.
So what does all this mean for someone trying to understand their kidney health? It sounds like combining these tests, blood, urine, imaging, maybe biopsy, allows doctors to really drill down and distinguish between, say, a sudden problem versus a long-term one.
Precisely. It helps them distinguish between acute kidney injury, AKI, that's a sudden rise in creatinine over hours or days, and chronic kidney disease, CKD, which is a slow progressive decline over months or years. And crucially, it helps pinpoint the problem's location. Is it prerenal, like that decreased blood flow we talked about,
Yep.
intrinsic actual damage to the kidney tissue, or postrenal? A blockage after the kidney, like in the bladder or ureters. It really is like a detective story, putting all the clues together.
Okay, having explored the incredible mechanics of the kidneys and how we check up on them, it's, well, sobering to then consider what happens when things go wrong. Let's turn our attention now to some of the many distinct pathways that can lead to kidney damage. Let's start with what we could call the silent damages. These are conditions that often work quietly, sort of in the background over many years, sometimes without any noticeable symptoms until it's quite advanced. First up, hypertensive nephrosclerosis. This is the insidious effect of chronic high blood pressure. How does that relentless pressure actually harm these vital organs?
Yeah, it's a slow burn, unfortunately. What's happening here is that the sustained high pressure physically damages the inner lining of the small renal arteries, particularly the afferent arterioles bringing blood to the glomerulus. Over time, these vessel walls thicken and narrow, becoming stiff and almost glassy, a process called hyaline arteriosclerosis.
Okay.
This narrowing reduces vital blood flow, causing ischemia to the glomeruli. It literally starves them of oxygen. Eventually, the glomeruli scar and harden. That's glomerulosclerosis, leading to a progressive loss of nephrons and that decline in GFR we talked about. It's a really slow, destructive process you wouldn't necessarily feel until significant damage has occurred.
Wow. Then we have diabetic nephropathy caused by uncontrolled high blood glucose levels in diabetes. This is a very, very common complication, isn't it?
Yeah. It is, unfortunately, one of the leading causes of kidney failure. With diabetic nephropathy, high blood glucose really messes with the tiny blood vessels around the glomerulus in a specific way. Imagine the incoming vessel, the afferent arteriole, widening, allowing more blood in, while the outgoing vessel, the efferent arteriole, constricts. It creates a bottleneck.
Ah, so pressure builds up inside.
Exactly. This dramatically increases the pressure inside the filter itself, that phenomenon we call glomerular hyperfiltration. It just stresses the whole system. Along with structural changes like the thickening of the glomerular basement membrane, this makes the glomerulus leaky. That allows protein, specifically albumin, to spill into the urine microalbuminuria. Over years, the sustained pressure and the structural changes lead to progressive glomerulosclerosis and ultimately kidney failure if not managed well.
It's really chilling how silently some of these conditions, like high blood pressure or diabetes, can work in the background, just relentlessly damaging vital organs without you even realizing it until it's quite advanced. It truly makes you reconsider preventative health, doesn't it?
Absolutely. Early detection and management are key.
But it's not just chronic diseases, right? Sometimes the culprits can be quite unexpected. Let's talk about contrast-induced nephropathy, or CIN. This is an acute decline in kidney function that can follow certain medical imaging procedures that require that iodinated contrast dye, like for some CT scans or angiograms. It's often asymptomatic, meaning you wouldn't feel it, but it's detected by a rising serum creatinine after the procedure. What's fascinating here is how common medical procedures designed to help us, can carry this specific risk.
It's true, and it's something clinicians are very aware of. These procedures are invaluable, of course, but for certain individuals, they do pose a risk. Key risk factors for CIN include having pre-existing chronic kidney disease, especially in eGFR below 60.
Wow.
Diabetes is another, heart failure, and importantly, volume depletion.
Volume depletion, so being dehydrated.
Essentially, yes. Not having enough fluid volume in your body makes the kidneys more vulnerable. Age over 75 also increases the risk. The mechanism seems to involve renal vasoconstriction, the blood vessels in the kidney constricting, reducing blood flow, and also some direct toxicity to the kidney tubules from the dye itself. Management primarily emphasizes rigorous hydration, giving plenty of fluids before and after the procedure, and using the lowest possible dose of contrast, especially in those high-risk patients.
Okay, that's really important to know. And then there's something many people might not realize. Common over-the-counter pain relievers, specifically nonsteroidal anti-inflammatory drugs, or NSAIDs like ibuprofen or naproxen, they can damage kidneys too. I hear this comes as a real surprise to a lot of people. This is called NSAID-induced nephropathy. What's the mechanism there? How does that happen?
Yeah, this one catches people off guard. If we connect this to the bigger picture of kidney blood flow, it's vital to understand the mechanism. NSAIDs work by inhibiting chemicals called prostaglandins. Now, normally, these prostaglandins play a protective role in the kidney. They help maintain renal blood flow, especially when the body is under stress, maybe due to dehydration, heart failure, or low blood pressure. They help keep the kidney perfused,
So they're usually helpful.
very helpful in those situations. By blocking these helpful prostaglandins, NSAIDs can significantly reduce blood flow to the kidneys, especially if there's an underlying issue, increasing the risk of injury. Risk factors are actually quite similar to CIN: age over 65, pre-existing CKD, heart failure, and critically, volume depletion again. Being dehydrated while taking NSAIDs is a particularly risky combination,
Right.
and NSAIDs can cause different types of kidney injury, including acute kidney injury from that reduced blood flow, but also a chronic condition called chronic interstitial nephritis with long-term use.
Huh?
Management primarily involves stopping the NSAIDs and ensuring adequate hydration.
This is such a crucial takeaway for our daily lives. Even seemingly harmless medications that we grab off the shelf can have significant impacts on these vital organs, especially if we have underlying risk factors or aren't properly hydrated. It really highlights the hidden tightrope our bodies walk every day.
It really does. Awareness is key.
Okay, so for clarity, once kidney issues are detected, doctors categorize the function into stages. It helps everyone understand the severity, right? The stages of kidney failure provide a framework for that.
That's right. It gives a common language and helps guide management. There are 5 stages, primarily based on your glomerular filtration rate, that eGFR number. Stage 1 means you have some evidence of kidney damage, maybe protein in your urine or an abnormality on imaging, but your GFR is still normal, so 90 or above. In stage 2, there's a mild decrease in GFR, somewhere between 60 and 89. Still relatively good function, but the decline has started. Stage 3 is split into 2. 3A is a mild to moderate decrease, GFR 45 to 59, and 3B is moderate to severe, GFR 30 to 44. Stage 3 is often when complications like anemia and bone disease may start to appear because those other kidney functions like EPO and vitamin D activation are really starting to falter.
Right, the non-filtration roles become affected.
Exactly. Then stage 4 is a severe decrease, with GFR down between 15 and 29. At this point, preparation for renal replacement therapy, dialysis, or a transplant should really begin in earnest. And finally, stage 5 is defined as kidney failure. That's a GFR below 15, or when someone is already on dialysis, regardless of their GFR. This is also known as end-stage renal disease, or ESRD. At this stage, dialysis or a transplant is necessary for survival.
That framework seems invaluable. It really helps both patients and doctors understand the progression of the disease and plan for the appropriate care step by step. That must be so important for long-term health and just quality of life.
It absolutely is. It allows for proactive planning.
Well, we certainly filtered through a lot today, the incredible anatomy and physiology of your kidneys, explored the vital ways they're assessed, and uncovered some of the, frankly, surprising pathways to renal failure. Everything from chronic diseases like hypertension and diabetes to common medical procedures and even everyday over-the-counter medications. It's a truly intricate system.
I think the most important takeaway here really is the profound interconnectedness of your body systems. Kidney health isn't isolated. It's truly a reflection of your overall well-being. It's impacted by your blood pressure, your glucose levels, your hydration status, and even those seemingly innocuous choices you make with medications. Understanding this holistic view is absolutely key, and it really changes how you think about your daily health choices.
So our provocative thought for you to ponder as we wrap up, consider how many invisible processes your body manages every single second just to keep you in balance, and how a seemingly small habit or maybe a medication you take without much thought can subtly tip that delicate equilibrium. What everyday choices are you making that might be impacting your internal filtration system, perhaps without you even realizing it? And how might that understanding empower you to take better, more informed care of yourself going forward?